Hi, my name is Dawn Wenning, and I'm a customer service representative. I would have to say I'm somewhat active. I don't power walk, but I like to bike. I like to go bike riding with my family. My doctor was Beights. I was at the point where I couldn't wear shoes anymore, so he removed a heel spur, some bone from my ankle, and detached my Achilles tendon, reattached and repaired it. I procrastinated because I was uncomfortable and I was afraid of going to the doctor or what was going on, but I knew something was happening because my foot was changing. The shape of my heel was becoming, it was pointy, so I couldn't wear shoes at a certain point with backs on them. And I thought, well, winter's coming, and I think maybe I might need to wear some snow boots, or how nice it would be just to put on a nice pretty pair of sandals, but I wasn't comfortable. And then I started to worry about my hips and my back. My back started to hurt because I was compensating. And I just, out of fear, wasn't willing to pick up the phone. And I'm so glad that I did. My first visit with Dr. Beights was, funny to say, very comfortable, and he immediately made me feel at ease. When he's speaking to me, he speaks right to me. He doesn't look up, look around, doesn't dismiss what I had to say to him or express my concerns. He listened and he took his time. He explained things thoroughly to me. So I found Seaview Orthopaedics. I actually started to do some research. I started with my insurance company, and then I went online and I looked up reviews. I liked the feedback from the patients because it was real. Seaview Orthopaedics, the staff, Dr. Beights, explained everything to a T. I knew exactly what was going to happen based on what they provided. They provided literature, they explained everything. You know, they wanted to make sure I was comfortable, and they did. I wasn't afraid at all. Dr. Beights came and saw me, and he revisited everything. He checked everything out, made sure I was ready, explained how long the procedure was going to take and what to expect. I followed instructions. I woke up, I had a cast on my leg, and I had crutches, and they had already explained on how to move around on them, and I wasn't in pain. I didn't feel like I needed to ask for medication, and I was pretty upbeat. It was great. So don't be afraid. The pain medication I did take, but I didn't need much for very long. I think in a couple of days I was done. In fact, less than a week. And I would take Tylenol if I needed it. 2 weeks I was back to work. I brought my knee scooter. I kept my foot elevated. Doc has me moving, range of motion. I'm in a shoe. I'm listening to my body, and I feel like I got my life back. I have shoes with backs on them again, enjoy time with my family again, and not feel like I want to stay home because it's going to be too difficult to walk around. And the surgery was worth it. It wasn't as bad or as scary as I imagined it to be. The recovery has been exactly as Dr. Beights has described it. He told me to listen to my body and to give myself time and have patience. The scar on my foot is minimal. I regret not picking up the phone faster. I let my fear hold me back. From the very beginning to when they picked up the phone and they scheduled my very first appointment to when I met Dr. Beights, you can't go wrong. Everything that they say happens. You can count on them. Don't wait. Just do it. Because the longer you wait, the longer you suffer. It could get worse. I know for me, it probably was a little worse than I needed it to be if I had gone sooner. But the procedure and the recovery has been really great. I feel like I have my life back, and I feel like I have my life back because of Dr. Beights and his team, and I'm really grateful. And I hope other people have the same experience that you've given me.